An ageing cohort of general practitioners has prompted calls for incentives to encourage medical students to consider a career as a GP rather than working in hospitals. A new report from the Australian Health Practitioner Regulation Agency has found that by the end of June, nearly 9% of all GPs in Australia will be over the age of 70. Dr. Catherine Hester is the Queensland Chair of the Royal Australian College of General Practitioners, and she joins us now from Brisbane for more on this. Dr. Hester, thank you for your time. Can you tell us about the situation of the age of GPs in Australia?
Good afternoon, Gemma. Yes, it's true. The population of healthcare workers, including GPs, tend to be ageing, and we're concerned that this will provide a little bit of an issue in terms of meeting our community's needs in the future, especially because we know we need more GPs in the future to help serve our populations, which are themselves ageing and also suffering from more chronic diseases. So we know that just over 8% of GPs are going to be over the age of 70, and we need to find ways to support this population of GPs to continue to serve their communities in the most safe and most beneficial way possible.
When we talk about communities, is it rural communities that tend to have the older GPs there?
I think we might feel the effects of the ageing population of GPs most acutely in our rural facilities. We find in our rural communities, GPs often really are embedded and are so important in their communities that they continue to work, especially when there's concerns that there's not another GP coming along who might be able to help share the burden and help care for the communities as well.
So when do GPs tend to retire if we compare them to other doctors or the general population?
Look, I think it would be really nice to see GPs being able to retire when the time is right for them and not to be forced out based on bureaucratic or regulatory hoops that they have to jump over. Unfortunately, what we've seen from this proposal is that GPs aged over 70 would be subjected to mandatory health checks, which in our opinion sounds a little bit draconian and maybe is not the best way to go around supporting GPs to continue to serve their communities in a safe and helpful manner.
So is there evidence that those health checks are perhaps bringing retirement forward?
Yes, and the concerning thing is that the mandatory health checks have no evidence to support them in terms of ensuring that GPs themselves are staying healthy and safe. So what we would really like to see is a more balanced approach, one where we support communities by making sure that there's adequate training for GPs and adequate support for GPs when they're working there, but also finding that it's not a punitive or overly bureaucratic system for our GPs who do happen to be over the age of 70 and are doing very valuable work for their communities.
And is there any evidence of inadequate care given by GPs who are older?
It's true that GPs, just like any other healthcare professional, might face challenges throughout their career, which makes it hard to help serve their populations. They might need extra support. We do see a very small proportion of GPs reported each year regarding concerns that their health is not adequate to do their job or for other concerns. But I think we have to see this in proportion because it's actually a very small percentage of GPs, so 0.25% to give you an idea, who have these sort of concerns raised each year. So it's a very small proportion of the population of GPs working in these areas that have concerns raised. We need to make sure that our approach is balanced rather than just a blanket sort of extra set of regulatory hurdles that these GPs have to go through.
And in terms of the next generation, I mean, are med students shying away from general practice? And if so, can it be made more attractive to them?
Absolutely. I'm a GP and I love being a GP. I think it's the best profession around. And I'm really looking forward to sharing that with junior doctors who are coming through and training. And look, in the last year, we've actually seen an uplift in the number of junior doctors interested in training as a GP, which is really heartening. We've filled an extra 20% of places for next year. But what we will be asking the federal government coming into the election next year, or actually this year, 2025, is that there is extra support for growing a GP population and support for encouraging junior doctors to choose this career.
Dr. Catherine Hester, the Queensland Chair of the Royal Australian College of General Practitioners, thank you for speaking with us.
Thank you.